Of course, we have to have you back because so much is happening in the nation. So let's go right into it, Doctor. My first question to you actually has to do with the big news that we're hearing today. States Texas and Mississippi have lifted their COVID-19 restrictions, which includes ending mask mandates as well as giving their businesses 100% capacity and allowing the businesses to open up again. My question to you is this wise? Should this be done right now? How are you looking at it as a medical expert?
So let's go back March 2020, we had less than 50 deaths and less than 1,000 cases in March 2020. We are at 500,000 cases, 500,000 deaths now. Texas and Mississippi removing the mask mandates, reopening the business at 100% is definitely against the CDC director's recommendation. CDC director warned state officials against lifting those public health restrictions. And I think this will be a huge impact on not only on the state, Texas and Mississippi, but across the nation.
Right. What's the worst case scenario?
With various variants spreading all over the states, we will lose the hand we had ground to gain control of this virus. We will lose the momentum. We will lose that grip on controlling the pandemic, and I think we can go back into circle again where we have more cases seen very soon.
Yeah, let's talk about these variants a bit, Doctor. You know, today I'm looking at more than 28 million cases and at least 516,000 deaths in this nation. They are saying the trajectory is going down, but is this variant worrying you? There is the UK variant, Brazil variant, as well as the South African variant. What can you tell us about it?
So variants seem to spread more easily and quickly, which lead to more cases, increasing number of cases, which put more strain on the healthcare system in the US, which can lead to more hospitalization and potentially more deaths. So definitely those variants are troublesome. I want to give you one number right here. Last 7 days only, we had more than 460,000 new cases in this country. And so that means 60,000 cases every single day. Average is 46,000 people are in the hospital, more than 40,000 in the hospital every single day, and 14,000 deaths in last 7 days. So we are not off the hook yet. We have to take all the precautions we can to fight this pandemic.
Right. With these two states opening up and also with what the variants are doing, Doctor, what's your prediction for the next 2 months?
So the original predictions was to have 600,000 deaths by April. The way it is going, we will see those numbers, and I think that is very sad scenario for us. If we all the states doing the same as per the CDC and public health recommendations, we definitely can beat this with this vaccine on horizon right now.
Right. Let's now talk about the vaccines, Doctor, because I have a lot of questions. The biggest one in the news is Johnson & Johnson's single-dose vaccine, which has been approved and is being administered right now. It is 66% effective against moderate to severe disease and 85% effective in most severe cases. People are a little hesitant about the efficacy of this vaccine. How are you looking at it, and what can you tell people about it?
So let me tell you, Johnson & Johnson vaccination is one-dose vaccine, which is 72% effective with one dose. Okay, it is very, very good vaccine, 85% effective against the severe disease and hospitalization, 100% effective at preventing death. So the ultimate goal is to prevent the death. In the viral disease, you need to prevent the death, and Johnson & Johnson vaccine is ready to do that. So my message to all the people who are getting the vaccine or who are ready to get the vaccine should take the vaccine whichever is available to them without any concern.
Right. Dr. Patel, Johnson & Johnson did a large trial, which was later in the pandemic. Do you think that's why the efficacy is low, because now they are dealing with these variants, which we didn't see last year?
So Johnson & Johnson was tested after some of the new variants happened in South Africa, which proven to be effective against those variants. So in my opinion, my medical expertise, I would say Johnson & Johnson vaccine will be much more effective against those South African variants for sure. And I'm pretty sure they will be effective against the UK variant as well.
And Johnson & Johnson is starting to study a 2-dose regimen, doctor, where they want to add booster shots. Do you think that's a wise decision on their part? And I keep on hearing the word booster shots even for Pfizer and Moderna. Can you explain to us what exactly they mean by that?
Yes. So right now, since this is only a 1-year-old virus, we don't know how this virus will react in upcoming years. Just like flu vaccine, we take it every single year. So this vaccine, COVID-19 vaccine, we may need to take it as a booster. As of right now, it's too early to say, but the way it is going, we may need some booster for all 3 vaccines.
Wow. Now let's take a look at Moderna and Pfizer, doctor. My question to you is, we keep on hearing about mixing the 2 vaccines, in order to speed up the process of giving vaccination, the 2 doses to people. Do you think it's wise to mix the 2 doses? How are you looking at it?
I would not recommend mixing the doses. If you take the Moderna vaccine, if you take the Pfizer vaccine, or if you take the J&J vaccine, you have to just take that vaccine only. There is no reason because that efficacy and safety has not been proven. So if you mix match those vaccinations, it's not going to help and it's not going to be effective.
Right. Moderna and Pfizer both have similar side effects, doctor. My question to you is, when you're looking at Johnson & Johnson, what could be the potential side effects of it, and is it going to be similar to the other 2 vaccines?
It will be the similar mild symptoms of fatigue and body ache and muscle pain. I won't expect anything more than that.
Right. What is missing in the vaccine research so far, doctor?
So vaccine research has been going wonderfully. Actually, we are so lucky that the vaccines are available within 12 months of the initiation of this pandemic. I think kudos to all the scientists and CDC and FDA for getting this process done. The most common I think drawback right now is the children getting vaccinated, immunocompromised people, and pregnant female. Those are the 3 categories we have to worry about getting more research done and get them immunized as quickly as possible.
Right. So the focus is to literally vaccinate every single person that lives in the country.
Absolutely. That is the focus. Yes.
Right. When you're looking at vaccine, I have 2 more questions to ask you about 2 different vaccines. The first one is AstraZeneca, doctor. It has been approved by the World Health Organization. However, in South Africa, it had to be stopped because of that variant that we were discussing. How are you looking at AstraZeneca? Do you think it'll get approved here?
What I'm hearing in the US, they may come for the final approval in April or May. And also that will be a game changer in this country. At this time, in the near future, this month, I don't expect AstraZeneca coming to CDC and FDA for approval.
Right. Doctor, now I want to take you back to our homeland, India, because there's a big news that's coming up from there. Bharat Biotech is showing 81% efficacy. Your comments on that?
Absolutely. India has been progressing very well with the vaccination. The only concern is our population. We have 130 million population there. So the way the vaccination program is happening right now, it may take 1.5 to 2 years to immunize everyone. So that is the only drawback, and that is because of the large large population of our country.
But definitely a good sign coming from India, I see.
Absolutely, it's a good sign, yes.
Right. When we're talking about vaccine, doctor, a lot of experts are saying or guaranteeing immunity for about 90 days. My question is, what happens after these 90 days?
So most of the vaccine, the side effects and the long-term side effects usually happens between 30 and 45 days. So this vaccine, all 3 of them had more than 60 days clinical trial, and they waited 60 days before submitting the data. So I think all 3 vaccinations in the US currently approved for the emergency use authorization has been proven that up to 60 days there were no long-term side effect.
Right. When you are looking at vaccine, doctor, I have some questions in regards to what we can do. We are hearing people that they want to go visit their relatives, they want to travel, they don't want to wear a mask. How are you looking at all of this? What's your advice?
So if the entire family is immunized, they can visit their own family as long as they follow the public health recommendation of wearing the mask, avoiding the large gatherings, staying away from other people. They can do the family activities right now. The key here is to wear the mask in public still, because you still can be infected and give the virus to someone else who were not vaccinated at this time. So it's catch-22. You have to follow the public health recommendation at this time. As a family, you can do your family chores. If you are in the home, you can get together as a family, do the backyard parties, but not gather in public.
Right. On mask, Dr. Anthony Fauci, nation's leading expert on coronavirus, said that Americans may be wearing masks up until 2022. What do you have to say about that?
That is probably too long of a time. In my opinion, I think by end of this year, we will see some difference. As long as we have 70 to 80% of our population is vaccinated. At this time, we are only 102 million dose distributed. 78 million people received the vaccine, which is about 8%. And roughly 10% of people got the immunity from the virus itself by exposing with the COVID-19. So right now we are at 20% of immunity. We have to create that 60% immunity in order to be safe and call this pandemic off. So Dr. Fauci is a scientist. He knows what he's talking about. I appreciate his expertise, but in my opinion, I think by end of this year we will see some difference.
Oh wow, that's a very hopeful news. Let's hope that actually happens. You know, another issue that's up for debate when you're looking at the vaccination program, doctor, is the vaccination of educators, teachers, and the staff that's working in schools. The CDC has gone ahead and said that schools can safely open as long as they adhere to those key guidelines. However, it's not necessary for teachers to be vaccinated. How are you looking at it? Teachers are concerned nationwide about getting this virus.
I think, in my opinion, teachers should be vaccinated because they are at risk unless they're in the younger category. They should be vaccinated before they go to the school in the actual classrooms. And I think it's very important that they are protected from getting this disease.
Right, for sure. You know, when you're looking at domestic travel, doctor, we are hearing that there's a talk about requiring vaccines for domestic travel, international travel. Do you think that should happen?
That should happen, and that should happen for the employer also. So if you're working in a grocery store, if you're working in a bank, if you're working in a hospital, you should provide that vaccination record in order for you to continue working there. I think that's long overdue. That has to happen.
Do you think we should be traveling?
Traveling is very tricky. So I always advise people, avoid traveling if at all possible, because traveling right now is not safe. When you go in the airplane, there is no restriction there. People are sitting next to each other with a mask on, and longer flight definitely puts you at risk of getting this virus.
Right. I have just 3 more questions left for you, doctor. When you're looking at the vaccination program, and I know they're trying to ramp it up, what do you think they can do? You know, what do you think they can add in this program, in this process, that could truly speed up getting, more shots into Americans?
So Biden administration definitely is taking some efforts right now to increase the ramping up of the vaccine. And one good news is J&J vaccination rollout plan includes Merck is helping them. So we are expecting 3.9 million vaccines this week, 20 million doses by end of March, and 100 million doses by end of June. I think that is a very good news that by end of June, we'll have close to 125 million people vaccinated just from the J&J vaccine. So increasing the ramp up, logistical nightmare should end very soon with J&J vaccine, and probably we are on the right track of beating this pandemic.
And when looking at South Asians at high risk, have you recently seen cases of them in COVID-19? How at risk are they still?
So South Asians, other minority groups, African Americans, Hispanics, people with color, I think we are all at risk because of our predisposition to diabetes, hypertension, cardiovascular disease, and some of them don't even know that they have it. So that is the whole reason we are at increased risk of getting COVID-19, and we all should be taking all the precautions even after the vaccine is taken to ensure that we don't spread the virus to our friends and relatives.
That's so true. And my final question to you actually has to be about your worry. What's your biggest worry right now when you're looking at this pandemic? What concerns you the most?
My biggest concern right now is people taking the liberty of roaming around without mask. They feel that they took the vaccine, they are safe. They are safe themselves, but they can spread the virus. Variants coming from the other countries, the Texas, Mississippi removing the mask mandates, reopening the business, those people coming back to New York, New Jersey, and other areas of the country definitely is worrisome for our pandemic response. And I think I see a huge problem if we don't control this as quickly as possible.
What's your advice to our viewers, Doctor?
Masks are effective way to reduce the spread. Have the mask on. You must have the mask on after the vaccine. Stay 6 feet away. Avoid crowding, indoor gathering. Take the vaccine as soon as you have it available. Whichever vaccine you can get hold of, that is the way to get it. Register for COVID vaccine if you haven't done so. Avoid having indoor parties, wash your hands frequently, and take all the common sense precautions public health officials are telling us to do. Don't listen to your politicians, but listen to your public health officials, including CDC, state and local officials. I think that is the only way we will be able to mitigate the virus spread in this country, and we can beat the pandemic in the upcoming months.